This segment of Delmarva Life is sponsored by Coastal Hospice.
Well, it's something we've all been guilty of at one point or another in our lives, putting things off, procrastinating, waiting until the last minute. Whatever you want to call it, it usually doesn't provide the best results. This rule also applies to getting people the health care they need. This is when we bring in Coastal Hospice. We'd like to introduce Nancy Stewart. She is the Director of Access and Coastal Palliative Care Services. She's here with Lauren Blair, the Director of Business Development. Ladies, thank you so much for being here this afternoon.
Thank you. Thank you.
So can we talk about some of the benefits of getting Coastal Hospice sooner rather than later?
Mm-hmm. Absolutely, absolutely. You know, when we see people all the time that kind of come in the last few days of life, you know, that's a big myth that people think too, is that you have to wait, that hospice is for the last few days of life. But really, the sooner someone gets on, the more that we can provide for them. We have our whole team, our physician, our nurse, our certified nursing assistant, social work, spiritual care volunteers, all working with that patient and their family, of course. So it really gives and empowering for the patients and families too, to be able to kind of take control of the situation, and you never want to wait till that the last minute you're faced with making decisions in a pinch, in a rush.
Yeah.
So kind of knowing about hospice services before you need it is really the key. And we do free informationals too if someone's just curious about what it entails.
Sure, and I think there's a lot of people don't actually know what it all entails. So we have some myths about hospice care, and I want to go over some of them. The one that I think a lot of people are going to be surprised about, hospice care is not just for end of life.
It's for anyone who has a life-limiting illness, but I think people think that end of life means the last few days. It's a 6-month benefit that is available to anyone and everyone who has that terminal diagnosis. So it is for end of life care, but it doesn't mean that it's for the last few hours or a few days of care.
Right, because people have actually gotten out of hospice care before.
Yes,
yeah, absolutely.
Absolutely.
Okay, so when people do start hospice care, do they need to stop taking their medications?
That's a big one we hear all the time. People assume that, you know, you come onto hospice and it's kind of like taking away things. But really, it's sometimes we do take away medications if it's for a reason to help them get a little better. You know, it's the first time really that a lot of patients are being looked at holistically. So, you know, you may have a primary care physician and a cardiologist and a neurologist, and they're all prescribing different things. Well, now there's one physician kind of managing all of those medications and being able to look and see, you know, this drug really kind of interacts poorly with this drug. Like maybe let's switch something up. Or, you know, Mr. Smith maybe was on this blood pressure medication for the past 15 years, but now he really doesn't need that. So sometimes when we can take away these things, people can actually perk up and do a little better. I actually talked to someone yesterday who was talking about how well her grandmother did when they looked at her medications and they kind of like cut back on some things, and she was shocked to see how much more you know, just more better that she was.
Right. Okay. Next one. Next question. Who can and how does someone make a referral to hospice care?
Anybody can make a referral. I think there's a lot of misunderstanding around that as well. We do get a good many referrals from the medical community, hospitals, doctors, home health agencies, but anyone can make a referral. And one of our largest referral sources are friends and family. Even a patient can refer themselves.
Okay.
So, and it's very easy for them to do. They just need to give us a call, and they call our access or admissions department, and they'll speak to someone who's trained to take their information and ask a bunch of really good information gathering questions. And the process starts from there. And depending on what their situation is, we can send a nurse out, or we can do an informational meeting like you talked about before. And that's as easy as the process is.
Thank you so much for clearing up all of this. I think a lot of people are going to be surprised with your answer. It's Lauren and Nancy with Coastal Hospice. Thank you for coming in.
Thanks for having us. Thank you.